Welcome, Lieutenant Governor McKee.
Good morning, Deb.
Good morning, Governor.
Yeah, thanks for having me here today, and thanks for all your really wonderful work on this issue that is so important to so many thousand people and live in the state of Rhode Island and all their families. I every time I get on one of these virtuals, I want to remind everybody about the health crisis and the fact that we need to stay healthy. So let's wear our masks, let's wash our hands, keep social distancing, and I think that's a really important thing to say to to all the people who are listening and caring and taking care of our seniors and also the seniors that are able to live on their own. We want to make sure that they stay healthy and during this health crisis. So thanks for having me here today. I would want to mention that a couple things I wanted to talk about today that you've asked me to speak to is one is the long-term healthcare council, the coordinating council that was established by state statute. Former Lieutenant Governor Charlie Fogarty was the one I believe who implemented it, and then every Lieutenant Governor after that has chaired the council. This time that I was elected in 2014, sworn in 2015. So for the last several years, I've co-chaired the council with Maureen Maigret, and I can't talk about the long-term care council, coordinating council, without talking about Maureen, who is really a champion and has been a champion for many, many years for senior issues in the state. So what things that we work on together, excuse me, long-term care standards and quality performance and its personal issues, including training and recruitment and staffing needs, enforcement of long-term care regulations, eligibility and access issues. There are members, we meet every month. And we have 40, 50 people every month that are there that are thoroughly involved in the senior issues. And Deb, you're one of those individuals that is there regularly to weigh in, whether it has to do with transportation, whether it has to do with our senior centers, or supporting our senior centers, or our nursing homes, or our home care, patients and individuals that have home care. It's a real comprehensive committee that I have been really privileged to be able to serve on for the last 5+ years, almost 6 years now. Oh my God, almost 6 years. And it's a important information center. And Deb, you're part of the information that gets shared on a monthly basis. But it helped us set up with Rose Jones and others, who's the director of our Health and Aging Department in the state of Rhode Island, and many, many other people who provide tremendous type of presentations. So we take notes on that. We take minutes. Our office does, as you mentioned, our office with Craig Dreyer and Paulette Hamilton and Tabitha Doobie and others that are involved with. We make sure our office gets very involved. Along to Deb and others that are championing the cause of aging healthy in Rhode Island. So we'll testify on issues. So if you have things out there that are important to you, you can contact Deb or contact our office, and then we'll take a close look at areas that might need legislation. We're certainly very interested in the MTM transportation issues out there right now, along with make sure that the small businesses are taken care of, but also more importantly that the seniors get the transportation that they're entitled to go to their doctor's appointments or to their different activities that they want to get to and they're unable to get to. So all our meetings are public, and as I said, we take minutes of those meetings and we post those minutes. So anyone who wants to hear more about what we're doing on the Long-Term Health Care Council, it's an open meeting. Anyone who's interested in the issues are invited and to attend, and we make that invitation to you. One of the things that we've been able to do is set up an executive board. We started on the Alzheimer's issues because when I was elected Lieutenant Governor, Liz Roberts and her staff had put together a state plan, and I think that we coordinated all the individuals, including Donna McGowan from the Alzheimer's Association, and the different doctors in the hospitals who are really active in the Alzheimer's. Rhode Island is very fortunate to have international, national leadership working on Alzheimer's right now. So if you have a family member, or if you are feeling as though that you're starting to get early stages of Alzheimer's, you should contact our office. There is support out there for families, and again, we become that information center. And we champion, our office championed this 5-year Alzheimer's plan that was passed by the General Assembly last year. This is the first official plan that was passed by the General Assembly talking about Alzheimer's. And the state plan, it's a blueprint for improving support and services for Rhode Islanders affected by Alzheimer's and dementia. 2018, my office embarked on this effort to update the Rhode Island state plan. We knew it was going to sunset in 2019, and we worked with the Alzheimer's Association, as I mentioned, Donna McGowan, raised some dollars from Tufts Health Plan Foundation and the Rhode Island Foundation, $30,000, and we used those to enlist the research services of Splain Consulting, a nationally recognized health policy firm, and we felt that that was very important. We don't have the expertise in our office. I certainly don't in this area. So let's go to the experts to provide us with the very best, roadmap, blueprint to help those individuals that are experiencing the Alzheimer's disease, and also the families that experience right along with the individuals that are stricken with the disease. We want to end Alzheimer's. But in the meantime, we have to make sure that we're doing everything we can to listen to the people who are in the communities. And we launched a community-based strategy to write this report. We did over 23 town hall meetings in communities around the state. I always say there's 39 cities and towns. They're all important. Everyone who lives in those communities is important. And the families and the individuals who are suffering through the Alzheimer's disease are certainly important to our community. We conducted 45 expert interviews and surveyed over 200 Rhode Islanders to get this report published. And our outreach efforts, we had recommendations, 30 recommendations that came through the report. Was allocate one director level position with the Rhode Island Department of Health to coordinate the implementation of the Alzheimer's plan, and promote Alzheimer's disease and related dementia research opportunities of all types, including federal funding opportunities, to a broad group of Rhode Island researchers. Rhode Island has benefited from our efforts. Just recently, major grants have been provided to the Rhode Island Hospital, the Butler Hospital, to research lifestyles, and so anybody who's interested in participating in those studies, they should let us know. We also are major advocates of diversity in the testing. We know that through the study and through the research that was done on the Rhode Island Alzheimer's plan, that people of color, Hispanic community are more likely to deal with Alzheimer's. And yet we don't have enough diversity in our clinical trials to really kind of help and determine, data that will be helpful to all our residents that are dealing with the Alzheimer's disease. So you can review the plan at our website, on the Lieutenant Governor's website. And last year, legislation passed. Senator Coyne, Representative Ackerman passed legislation establishing a formal executive committee, a formal Alzheimer's committee, as we recommended, is working out of the Department of Health right now. Nancy Sutton is co-chairing that with me right now, and we're having regular meetings, and we're very serious about it. And we just completed, and through Nancy's leadership, an application in Rhode Island was selected for a grant, $300,000 grant, federal funding, to help improve Alzheimer's care. in Rhode Island. And we know that the work that we did, our office with our partners over the last several years, establishing that Alzheimer's plan, working with the grants that we received to get out into the communities, the informal executive board that we had established, all that data, contributed into providing Rhode Island being selected as one of a few states that is going to work with these federal funds. And we know that with the help of Senator Jack Reed and our other congressional leadership, but in particular Senator Reed's office, that we had a good advocate there to bring in funding to the state. And I believe when we're all said and done, that Rhode Island's going to be a leader, a national, international leader, will continue to be in the research, in the data information, to make sure that we're front and center, and we're going to be very aware as we get closer and closer to the cures for Alzheimer's, and so that's what we're working on. We also are doing. We're beginning to start. I think October 8th we'll have some of these virtual meetings again instead of in the community meetings because of the COVID. We'll be establishing a meeting that with grants that we received recently from this year from the Rhode Island Foundation and the Tufts Health Foundation. On October 8th, we'll have a Living Alone with Alzheimer's session. We'll make sure that's available to Deb and to all our networks dealing with this very important issue. So, Deb, with that, I will kind of hand it back to you. If anyone has any questions, please let our office know, and we'll make sure we get all this information back to Deb and the leadership that she's provided here with the Rhode Island Elder Info Network.
Lieutenant Governor, before you go, I did have some pre-submitted questions for some individuals that they were going to have to watch this on replay. They weren't able to join us this morning. So the first question, can the state subsidy for the copay funding be increased, allowing agencies to offer home health aides a more competitive wage? And the second part of that question is, can the independent provider program be expanded to include copay eligible seniors?
Well, I'm not sure exactly how that happens. That's part of the debate out there, Deb, and that's part of the effort that our long-term care council gets involved in. So the individuals that are asking that question, they should, contact our office, and I think it's going to need advocacy to make that happen, and that's what this program's about, is advocacy for our seniors, and our office in terms of co-chairing with Maureen on that on those important issues. We can look into that and determine whether that's a policy or regulation or a statute issue, and be happy to follow up on it.
Yeah, that would be great. And I'm looking through some of the other questions here that people have posed, because of course my guests are always happy to answer questions that people are putting in the chat box. Do you know what the status is as far as the senior centers reopening?
Yeah, and so some are, because especially with the food services, they're very active. I was at the senior center in Woonsocket earlier this week, and they're very active, but primarily in the food distribution. But they also they participate in, just like we are today, with different virtual efforts like this. I know that Aging Healthy in Rhode Island we have some other websites that have tremendous activities for our seniors. I don't have that, the web connect here, to tell people the link, but there's major activities that are connecting in seniors in a fantastic way through their senior centers. I'm sure that they are still taking calls. I know that our senior center in Cumberland is taking calls, and those individuals that are looking for those activities that they would have had normally when they're visiting physically the centers, they can get some valuable information out there. There's no reason for anyone to feel as though they're isolated or alone right now, Deb, because the efforts that are happening with like you are today, and our senior centers, and our with Director Jones and others. Please don't be bashful out there. That's the message I would deliver to any seniors or families who have seniors. that need help and want to participate in certain activities that they enjoyed. I know our senior center, when I was a mayor in Cumberland, was a major stop off point for hundreds and hundreds of seniors every week, and I know that happens in every community. So don't be bashful. Reach out. There are programs that are going on right now virtually, and there are some activities that are happening physically. Just seek that out in your favorite senior center that you normally would go to.
Thank you so much, Lieutenant Governor. I really appreciate you coming on today. I think this is great. And you're right, Age Friendly Rhode Island is running the virtual senior center. You can find that on the Age Friendly website. Vin Marzullo is checking in. He's letting us know that AARP is running a lot of programming as well. So if people can see us here on Facebook, we know that they can navigate across the different platforms to be able to get connected to the information that's out there. And right after COVID hit, when everything was really kind of still, well, it is still scary, but right after COVID hit and we weren't really sure what our next steps were, I happened to talk to Bob Robillard over at the Coventry Senior Center. And he said, our doors might be closed for people to come in, but our hearts are still open. So I always think about that when I think of the senior centers. They're still there. They're still working for our seniors to try to get them connected to the information and resources that they need. You might not be able to go inside for some of them, but they are still there and they're providing a tremendous resource. And like you said, in particular to food for folks.
Yeah, Deb, and I think that they are also continually looking for volunteers. If you're healthy and capable, there's work to be done. It's just different type of work, but it's important work to help our seniors that live in the state of Rhode Island and making sure that they receive what they need. And again, I think those resources are there. I think Director Jones is fantastic, and along with the what you're talking with Age Friendly Rhode Island and your services and. It just goes on and on and on. And our office is we'll do handoffs to people who can help individuals, and we've received those calls just like you have, and then we make sure that the individuals that call, their answers, the questions are answered, and the help that they need, we make sure we provide to them, and whether it's regardless of what community you live in, I continue to talk about 39 cities and towns. Everybody lives in all those communities are important, and the communities that make up those communities are important. So anybody that's in a senior, the families that are servicing seniors, the different facilities that are servicing seniors, they've really stepped up during this time frame. As I was saying, the main goal right now is to make sure we keep everybody healthy, right?
Mm-hmm.
Everybody healthy.
Yes. Thank you so much, Lieutenant Governor. And you're right, everybody, wash your hands, wear a mask.
Yes.
Thank you so much for joining us today. I really appreciate it.
Well, we're going to keep on working together, Deb, because you got the energy and you're really providing these wonderful information strategies to seniors throughout the state of Rhode Island. So thank you for that leadership.
Thank you.
Yeah.
I appreciate it.
Yeah.